Hi, I'm Dr. Paul Thielking, Chief Scientific Officer at Novamind. It's been my life's work to help people suffering from depression and anxiety and emotional distress related to serious or chronic illness. I'm here today at our Murray Clinic in Utah where we're launching the Psychedelic Palliative Care program. This innovative program combines psychotherapy, mindfulness, psychedelic medicine, and group support in a safe and nurturing environment for patients and their families. Psychedelic medicines, including ketamine, now offer new, fast-acting options, and the evidence for their safety and efficacy is growing. The program will start by offering research opportunities with ketamine and will establish the infrastructure for future psychedelic-assisted therapies, including psilocybin and MDMA. Through our contract research organization, we're working with leading drug developers to give patients a chance to participate in innovative studies and bring new, faster, and better treatments to those who really need them.